or trauma leads to multiple missing teeth, an implant-supported bridge may be an excellent option to fill the space. A large gap prevents proper chewing, puts strain on adjacent teeth, the jaw joint, and could potentially lead to excessive wear of the remaining teeth that must now bear the load of chewing. With further bone recession, the teeth are prone to sensitivity and decay. Before an implant can be placed, the site would be prepared to receive an implant. Once ready, the implants can be placed in the jaw. Healing caps are placed on top of the implants to allow for the bone and gums to heal around the implant for several months. On a return appointment, the healing caps are removed. Impression copings are screwed into place. And an impression of the lower jaw is taken. The impression will help to create a permanent bridge for the implants. The impression copings are removed. The healing caps replace the copings until the next appointment. The healing caps are removed. Abutments inserted. Then the permanent bridge is cemented into place.